Well, hi, I'm Bob Schrupp, physical therapist.
Oh, excuse, I'm Brad Heineck, physical therapist as well. I was just looking at this book about cervical surgery. It's rather interesting, but it kind of relates to what we're going to talk about today, right,
That's
Bob?
right, we're going to talk about Peyton Manning.
What are you reading about?
Oh, I'm reading about advanced surgical surgery.
Oh, where did you get that one?
Well, that's not available to you because you're just not up to my level yet, so. Okay, anyway,
Let's get serious.
Let's get serious. Peyton Manning apparently has had 2 surgeries, and again, we're not really privy to what went on, but they are talking about a cervical disc and a cervical bulge. And so what we would talk about, what we thought we'd show you today is what we speculate may have happened. And then also, I'd like to just briefly touch upon how we often treat this.
Exactly, right.
Just show movement.
Well, when it comes down to it, take the human body, whether you're a football player or a basketball player, or you're just an average Joe like you and I, we all have the same spine. We got 7 cervical vertebrae, 12 thoracic, and 7 lumbar. Is that right?
5 lumbar.
5 lumbar. Actually, some people do have 6. But the basics are there, and what we're going to talk about is going to inform you on really what's going on beneath the skin.
Okay, so this is a spine. This is where your head would be. It's kind of cut off here. This is your pelvis. These are the legs. The first 7 bones that stack up here make your neck. All right? And I'm not sure exactly at what level he had trouble with, but it had to be one of the first 7 because it did involve the cervical or the neck. Now, in between each one of these bones or vertebrae are a disc. And in a minute we'll show you exactly what that looks like by using a larger model. But I don't know if you can pan in here at all and see any of this. Which angle would be best here?
Yeah, probably like this. Let's bring it right into here. The majority of neck injuries occur in the lower vertebra, which we're 1, 2, 3, 4, 5, 6, 7. So we're talking usually 6 and 7, 5, 6, or 7 are usually involved. We don't know that for sure. They don't let that information out. But that's where it's probably at, wouldn't you agree,
Right,
Bob?
exactly.
Okay, so we're probably talking the lower neck. So on your body, if you go back here and you feel there's that big bump there that most people have, that is C7. Okay, so we're talking about that part of the neck, if you can see that. Okay?
The other thing I want you to point out, that I want you to see on this model here is that these yellow things coming out here. Now these are cut off. They extend all the way down into your arms. Those are the nerves, and those are what can give you pain. And what happens is the disc can actually bulge. Usually a bulge doesn't do it, but maybe a herniation will actually push on that nerve and send pain down into your arm or into the upper quadrant here. So that's what we're going to show you when we use our model, is how that can happen. Any other comments, Brad?
No, yeah, these look like little worms, but they're not. They're actually nerves, and that's really what they look like if you do look at a real cadaver. Yep. Mm-hmm. The only thing I wanted to ask is, this is a pretty short person. Look at these legs, huh?
Yeah, he'd make a good baseball hitter because you couldn't pitch to him. So. All right, why don't we cut right now and then we'll bring into the model.
Okay, we're going to continue on with looking at in detail the injury that can happen to the cervical spine. A very common one that Bob talked about it is being a bulging or a herniated disc. Okay, let's see, I need something to point here. Lindsay, can you throw something in? Oh, nice job. Thank you. All right, let's zoom right in here, okay, Lindsay? Right in where the pin is. You can get as close as you can. Okay, here we go. We're going to look at C6 and C7 right here. Cervical vertebrae number 6 and number 7. They start from the top and you count down. Now if you look right in here is the disc. Okay, here's the nerve that Bob was talking about. Now if the disc herniates or shifts and gets tissue and presses against this nerve right here, great source of pain. And again, it doesn't just hurt here, but the pain can radiate where the nerve goes, so that can go into the scapular region, by the shoulder blade, down the shoulder, and it can go all the way down into the hands and fingers, which obviously for a professional football player trying to throw the ball is going to cause some issues. So what we need to do is get in there, clear this area out in here so the nerve is freed up and it can move and we can have normal range of motion with the neck, so we can look right, you can look left, look downfield for the long ball, look for the short ball, and have some success passing. So that's what we're going to look at right there. Okay, now let's look at those two vertebrae. I said C6 and C7. Go ahead, throw me. There we go. Here we got a couple models here. Well, Lindsay, the model behind the camera, but she's not coming out today. Actually, seriously, we've got the vertebra cup model, okay? Coffee cup that people in the health field will use, particularly therapists and orthopedic surgeons. You got some coffee to drink, it works great for this demonstration. Here's C7. Remember the disc I talked about? A disc is not rigid like a hockey puck. There's some fluidity to it, and it has some give so that you can rotate your neck up and down and around, etc. So this works great for a model, okay? So here we got C6, C7. Now if you were to rotate your head to the right, if you can see a little bit of give between each vertebrae as it works up the chain.
Right, looks like you've had too much coffee.
Yeah, I'm shaking there.
You want me to hold it?
Yeah.
I don't know if any better.
Okay, so they can rotate this way, this way. Now when you bring your head down, look what happens. Okay, it separates back here. When you look up towards the sky, whoops, you give way here, and that, whoa. And if that happens, you got some serious problems. Okay, all right. I think I'm gonna have to do this by myself.
Okay.
Yeah, that's all right. I'll quit shaking so much. All right, here we go. So let's zoom in right in here, Lindsay. Right in here is where that nerve, we're going to use this pin as that nerve came out of the spine, and that goes down into the shoulder, into the arm. Now what can happen through a real dramatic jolt to the head, or this can happen to people like working on a computer and have poor posture. What we're going to talk about in Peyton Manning's case, he probably had a severe blow to the head as he had a number of concussions over the years, is this can happen and the disc can actually bulge out like that. This is a really neat model. This is the neatest thing that we really invented for instructing and educating patients on how discs herniate. But you can see where if that happens, it's going to interfere with that nerve, creating a lot of pain, a lot of problems, and that's what they got to get in. And with surgery, they're going to just actually cut that right off, get things back in. Then it's going to take a number of weeks for scar tissue to heal over that and start to regain range of motion and become functional again. How was that, Bob?
Good, I think, did you cover it?